Everybody, it's Tanya from the Teach Project. Welcome to today's Lunch and Learn session. Today's session is Waterpipe use in Canada and evidence for exposure in Toronto hookah cafes. The faculty presenters today are Dr. Roberta Ferrence and Dr. Feras Hawari. If you are interested in obtaining a letter of completion for today's session, please be sure that you have completed the registration and pre-learning assessment. Please be sure to sign in to today's webinar using your first and last name. And following the webinar, I will be sending out the post-learning assessment by email. These webinars are being live tweeted on Twitter. Please follow the CAMH Nicotine Dependence Services at PS Quit Smoking. To follow the live tweeting or to post your questions or comments using Twitter, follow #TeachWebinar. Our first presenter today is Dr. Roberta Ferrence. She's a Senior Scientific Advisor for the Ontario Tobacco Research Unit at the University of Toronto, Professor in the Dalla Lana School of Public Health, and Senior Scientist Emerita with the Center for Addiction and Mental Health. She has training in epidemiology and medical sociology. Her research focuses on tobacco smoke exposure, including the economic and environmental impact of smoke-free bylaws, indoor and outdoor air quality studies, including Waterpipe, and third-hand smoke exposure. She has published more than 150 peer-reviewed papers and has authored 3 books, including Nicotine and Public Health. Dr. Feras Hawari is the Chief of Pulmonary and Critical Care at King Hussein Cancer Center in Jordan, a consultant of the Pulmonary and Critical Care Medicine Division, Director of Respiratory Therapy, Director of Cancer Control Office, and a full member of ICU Adult. Dr. Hawari's specialty is focused in pulmonary and critical care, and he has clinical expertise in critical care oncology, pulmonary complication of bone marrow transplantation, drug radiation-induced pulmonary diseases, bronchoscopy, and cardiopulmonary exercise testing. Dr. Hawari completed his medical education at the University of Jordan School of Medicine and then completed residency in internal medicine, State University, New York. Dr. Hawari completed a fellowship in clinical pharmacology from the State University of New York and the Pulmonary and Critical Care University of California. Dr. Hawari and his team are leading activities to build the network and advance tobacco dependence treatment and tobacco control policies across the Eastern Mediterranean region. The following are the disclosures for both Dr. Roberta Ferrence and Dr. Feras Hawari. As well as TEACH disclosures. The TEACH curriculum and slides were developed and compiled with funding from the Government of Ontario, Ministry of Health and Long-Term Care. Content of slides are primarily based on evidence-based guidelines from the following 3 sources. These materials, as well as a verbal presentation and any discussion, set out only general principles and approaches to assessment and treatment pertaining to tobacco cessation interventions, but do not constitute clinical or other advice as to any particular situations, do not replace the need for individualized clinical assessment and treatment plans by healthcare professionals. Okay, I'm going to hand it over to Dr. Feras Hawari now.
Good morning, good afternoon, and good evening to all of you. I'd like to thank CAMH for arranging this. It's really a pleasure to be with you. I hope you can hear me fine. What I'm going to try and do quickly today is to talk about Waterpipe, the anatomy, describe the epidemiology that we have, talk a little bit about the toxicology, and discuss some of the aspects of cessation. Of course, it's a short period of time, so we're going to try and rush through that, hopefully. So for those who are not familiar with Waterpipe, the story states that it was probably invented by an Indian physician in the 16th century. And at that time, the thought was that the smoke, when passed through the water in the bowl, it would be rendered harmless because a lot of these toxins are filtered in this water. Unfortunately, that is still the concept today that is driving, or one of the concepts that is really driving the use of water pipe across the globe. Now, you will see different names for water pipe depending on the country. As you can see on your left-hand side, you have the countries and then different names for water pipe. I'm sure you've heard of them, like hookah, shisha, goza. So it really differs from one country to the other. But if we come down, if we talk about the anatomy and the basics of water pipe, it is all the same. So as you can see on your
Dr.
right-hand
Hawari,
side,
I'm
you
very
can
sorry to
see the
interrupt. Some people are saying that it's difficult to hear you. If possible, could you please try turning up your speaker volume or perhaps move your laptop closer so the webcam is a bit louder?
My speakers are on the highest
That's
volume. Is
actually
it
much
better
better on
now?
my end. If people could start. Okay, that's much
Okay.
better. Thank you.
So I'll keep it close like that. So if we look at the structure of the water pipe, you can see the head, and on the head we place the tobacco and the charcoal. The charcoal would heat and burn the tobacco. The smoke is then moved down through the pipe into the water when the person sucks on the hose. As the smoke passes through the water, some of that toxins are filtered, and I'm going to discuss that actually. A new study that came out of Jordan just last week, saying that only actually 30% of what is inhaled through the water is filtered in the water. So the myth is no longer valid, and we know now that most of these toxins are actually not filtered through the water. And the to talk about some of the reasons why water pipe is spreading now across the globe, you can see that there are lots of reasons, including the availability, the cheap price. When you buy a pack of cigarette versus a pack of tobacco that is designed to be used for water pipe, it's a lot cheaper. It lasts longer, and you can do many sessions from that one pack of tobacco. In addition, we have so many reasons why this water pipe is spreading, such as the lack of policy for control, for example. Another very important factor, and I think this is probably the most important, and we saw that actually firsthand in the Middle East, and that is the introduction of the flavored tobacco, or what we call mu'assal. Once that was introduced in the early 90s, we could see actually the spike in the increase in water pipe use across the region. Of course, there are the misperceptions that we talked about, that water pipe is not addictive, it is less harmful than cigarettes, and that users can quit at any time they want. In addition, that it is socially more acceptable. So, for example, here in Jordan, it is really less acceptable for ladies to smoke cigarettes. However, in a study that we did in Jordan, at random schools, we went to 4 schools, samples of 120 girls in the 6th grade. We found that 13% of them smoked water pipe at home with their parents. So you can tell really the difference between the water pipe and cigarettes. And as you can see also from this picture here, where people can mix, you can see the pack of cigarettes on the table as well as the water pipe, and people are using this interchangeably. Now, what are the toxins that are present in water pipe? If we look at this question here, just to confirm the concepts that we talked about, all of the following statements about toxins in water pipe are correct, except flavored or mu'assal tobacco used when smoking water pipe contains a significant amount of nicotine. The use of charcoal increases the health risks from smoking water pipe. The water filters most of the toxins, rendering water pipe smoke harmless. Exposure to secondhand smoke from water pipe is harmful. So obviously, we mentioned this many times now. All the other statements are right, except that water filters most of the toxins, rendering water pipe smoke harmless. The tobacco that people use in general for water pipe is variable. So we have the mu'assal, or the flavored tobacco, which contains about 30% there are many flavors in that. Really, I'll show you a picture of that, but is made mainly from rotten fruits. Just about any fruit you could think of, it is rotten. They make it and mix it with glycerin, and they add molasses and tobacco to it, so that it is really a mix of all that together. We have the type of called Jarak. We have the Ajami, which is the pure dark paste of tobacco. And people can use any of those. However, the most used one now is actually the flavored Mu'assal tobacco, and this is a picture of that. You can see how slimy, gooey, and it's mixed with so many things, and it's made of any kind of fruit you could think of. Now, an added hazard to water pipe, and this is something that we are frequently asked about, which is basically which is more dangerous. And this is when we start to talk about charcoal. And as you know, it's a restricted product under the Hazardous Product Act, according to the Canadian Department of Justice. So this charcoal really adds a lot of other toxins, such as metals, producing carbon monoxide and other chemicals that really adds insult to injury, making water pipe very toxic, in fact. And as you can see on this slide, that water pipe contains many toxins, including hydrocarbons, nitrosamines, heavy metals of all types, forms. In fact, a new study that came out last week again showed that in addition to those metals that we see on the right-hand side, such as arsenic, beryllium, chromium, that we found significant amount of uranium when we compared, that study was done at one of the university here in Jordan. When they compared different flavors of or forms of mu'assal, they all contained uranium, and at significant concentration, a lot more than it's allowed to have in drinking water, for example. So that's an additional danger that has been just discovered. So if we look at the toxins in water pipe and compare that to cigarettes, you can see here for heavy metals, and you can see that for just about all the heavy metals, water pipe actually contains a lot more toxins than what is present in cigarettes. In addition, look at the tar component here, 72 times more tar in 10 grams of hookah when compared to one cigarette. And if you look at the nicotine, carbon monoxide, again, all these toxins are present significantly more in water pipe than in cigarettes. And look at the puff topography when measured by this computer attached to the water pipe. This is basically how we compare water pipe to cigarette smoking. So if you need about 8 to 12 puffs to smoke a cigarette, you smoke about 200 puffs when you are smoking water pipe. Duration a lot more. The liters of smoke inhaled is a lot more. And of course, carbon monoxide. Some people, there are case reports of acute carbon monoxide toxicity or poisoning just from smoking water pipe. To the point that now the studies compare water pipe, a single water pipe session of 45 minutes ranges in equivalency between 10 to 200 cigarettes, depending on the puffing technique and the depth of puffing of a smoker. Now, can water pipe cause dependence? And the answer for that, in short, is yes. In fact, it's been shown that one session of 10-gram water pipe tobacco produced 4 times the nicotine in one cigarette. And the daily use of water pipe produced a 24-hour urinary cotinine level of 0.785, which is the equivalent of smoking 10 cigarettes a day. Now, again, that is variable depending on how professional a person is in smoking water pipe. And if we look at other studies that compared the urge to smoke, restlessness, craving to water pipe, and other parameters, when they did a before and after study, they found that urge to smoke, restlessness, and craving all significantly decreased after smoking water pipe. In addition, others found that all symptoms were significantly associated with the number of sessions. So people who smoked more sessions, or sometimes we call them huggers, had more symptoms. For example, time to the first smoke of the day, smoking even when ill, time to tobacco craving, hating to give up the first smoke of the day. As you can see, this has all been shown in cigarettes and now shown in people who are use and dependent on Waterpipe. In addition, smoking and recovery phases after Waterpipe, tobacco smoke, and cigarettes showed similarity in the way in that they both suppressed withdrawal and suppressed craving. So again, this is a confirmation that nicotine and Waterpipe can actually cause dependence. Waterpipe tobacco smokers completed 2 double-blind counterbalance sessions. Again, this is a different study that looked at tobacco and tobacco-free preparation, because people always say, is it all about nicotine when you smoke Waterpipe? So this study was a very important study that compared smoking real tobacco Waterpipe to a sham. And this is what they found. So if you look at the panels here, you can see panel A, where there was a difference between the plasma nicotine and in those who smoked real tobacco versus the sham. Panel B, there's also a difference in heart rate in those who smoked, as you can see in the dark black triangles, when you compare them to those who smoked the sham. Both the sham and the real tobacco had similar carbon monoxide levels. And you can see here that the systolic blood pressure was a little different in those who smoked the real tobacco versus the sham. However, they found also that there was a physiological dependence that when people smoked the sham also had less craving, reported improvement in craving. They reported improvement in symptoms that we mentioned relevant to Waterpipe or nicotine dependence. In addition to that, now people invented a Waterpipe dependence scale. It's called the Lebanon Waterpipe dependence scale. It is similar to the Fagerstrom dependence scale. However, it's a little bit more difficult to use because it is a little bit longer. But that scale now has been used and validated in real life. So Waterpipe dependence, there is a physical component, has been shown when we compared the sham versus real tobacco. Waterpipe dependence is related to nicotine, as we saw that there is amount of nicotine. And in addition, you can measure that with a scale that is similar to use that we use in with cigarettes. Now, what are the health effects that we know about Waterpipe? This is a study that basically reviewed all the literature that looked at and considered what is out there. They started with more than 1,600 articles. They excluded really case reports and looked at what is significant out there in the literature when we talk about the harmful effect. And this is what they found. They concluded that there is a significant association between Waterpipe tobacco smoke and lung cancer, respiratory illnesses, low birth weights, and periodontal disease. At this point, we do not have sufficient evidence to say that there is an association with bladder cancer, nasopharyngeal cancer, esophageal cancer, oral dysplasia, infertility, or hepatitis C. However, they made a very important observation when they did this comparison or this analysis. They also thought that the level of quality of evidence varied from very low to low. So we really need better studies now to link Waterpipe to the diseases that it is causing. Another study which did exactly a similar approach, a Cochrane approach, and again, they started with similar number, more than 1,600 studies, and compared the effect of Waterpipe on lung function. And basically, what they concluded that Waterpipe had comparison effect on FEV1, FVC, and the ratio of FEV1 and FVC when compared to cigarette smoking. So Waterpipe and cigarette smoking in terms of lung function have similar effects. Now, because of the fact that Waterpipe now is common in youth and even in athletic youth, there's this concept that smoking one session of Waterpipe is not really harmful. Because of that, we at King Hussein Cancer Center, we did a study on the acute effect of Waterpipe smoking on lung function and exercise capacity. It was a pilot study on 24 students aged between 18 and 25. We did a baseline pulmonary function test on these guys and a cardiopulmonary exercise test. Basically, they go on a bike, they wear a mask, and we measure gas exchange, and they exercise for 10 minutes with an increasing resistance on the bike. We rested these guys for 3 days and had them smoke a water pipe session in a coffee shop that is conveniently located near our cancer center, brought them back to the lab within 5 to 10 minutes, and we repeated those tests. And as you can see from the results here, that, for example, carbon monoxide went up to about 24.4 parts per million. And when we looked at their oxygen consumption, which is an indirect way of measuring their exercise capacity in addition to time, there was a significant drop in oxygen consumption. There was a significant drop in oxygen pulse, which is a parameter that indicates either stroke volume or also can be reduced when we have muscle problems. We hypothesized that possibly there is chronic toxicity in the muscles that might be contributing to this low oxygen pulse. In addition, we found low FEF 25 to 75 in similar patterns when you compare that to cigarette smoke, indicating acute airway obstruction. Their Borg scale, which is a measurement that reflects basically exercise tolerance in these subjects, was also reduced when we compared their exercise before and after. And again, there were some changes in their baseline systolic blood pressure, pulse pressure, and pulse pressure product. Again, their oxygen pulse or O2 pulse went down, and the heart rate over their oxygen consumption, which is the amount of heart rate that is required to do the same exercise, was increased, indicating that they reached to their peak exercise capacity faster and at a shorter time. Now, moving on to the pharmacological regimen that provides the best abstinence rates for treating water pipe dependence. How do we treat water pipe? What is the best agent we use? Is it NRT? Is it NRT with bupropion? Is it NRT with bupropion and varenicline? Or is it none of the above? Well, the way it stands right now is that we really do not have any randomized controlled trial on how to treat water pipe dependence. It is really, we feel that it is much harder to do that. And in our clinic, we spend a lot of time on treatment. In fact, the interest of people to quit water pipe smoking is a lot less. So, for example, when you look at smokers, we know that more than 70% of them would like to quit smoking. However, less than 30% of water pipe smokers are interested. The majority reported health concern as a primary reason, and about 59-60% made an unsuccessful attempt in the past year. So how do we do that? How do we treat them at our clinic? Really what we have is really anecdotal information. We try to get a detailed pattern of their use. We try to time our nicotine replacement to their session. We use a combination of NRT, especially for those who are still going with their friends to coffee shops. We are using varenicline, and we are combining varenicline with nicotine replacement and bupropion. It is extremely difficult. People might quit. However, 6 months down the line, they can still feel the urge to smoke, especially when the weather is nice and they're having a good time. We really need a lot more studies to see how we can handle the treatment of water pipe. However, we cannot wait for these randomized clinical trials, and we have to continue with what we have right now. That includes NRTs, bupropion, and varenicline. We really need some actions now, and they are really required. We need a lot of research, look at trends, harms, and cessation. we need to really develop regulations to curb the spread of Waterpipe, including, and I think this is probably the most important thing, is to immediately ban flavored tobacco, which is really fueling the spread of Waterpipe. We need to develop health warnings and pictorial warnings. We need to have a very good advertisement against the false security about the safety of Waterpipe. Cessations interventions are a must, and we need to heavily educate our healthcare providers and the vulnerable groups about the risks of Waterpipe. I believe this was my last slide, and I'd like to thank you for your attention.
Great, thank you, Dr. Hawari. So I'm just going to remind you to please mute your microphone. Great, thank you, Dr. Hawari. So I'm just going to remind you.
Sure.
Okay, so I'm going to hand it over to Dr. Roberta Ferrence now.
Very interesting talk, Dr. Hawari. People may wonder if there's anything left to know, so I'll try and focus on some different aspects. But that was very interesting and very helpful. Oops. Oops. Just a second. Oh, use. Oh, these are. Oh, these are. Okay. So, Dr. Hawari covered some of the epidemiology of Waterpipe, but I'll go into a little more depth with a bit of recent information. There was a survey in 2006, but then nothing more till 2011, which is a large gap. I'm not sure why that happened, but at least over that 5-year period, we saw among adults, we saw a doubling in use. And in the province of Ontario, we have data for 2012 and found 2% of adults 18 and over were using Waterpipe in the last month. Among students, we are now asking that every year, and we will have 2015 data out this fall, but right now we're with 2013. So over 11% have ever used, almost 10% in the past year. And what's very interesting from the 2013 data is that there are now more kids who've used Waterpipe at least once in the last year as have smoked regular cigarettes. And of course, multiple substance use is what's happening now. Sort of the more different substances you use, the more you use. So almost half of current cigarette smokers used Waterpipe compared to only 6% of non-smokers. So use is highly correlated. I was involved in a court case about 5 years ago in Vancouver when they were charging 2 hookah cafes who had served hookah, who were serving hookah indoors in contravention of the local municipal bylaw. And this went to court, and I've been doing research on tobacco and tobacco smoke exposure for many years. So this seemed like a really important area to get into. So that's how we came to the point where we smoking hookah indoors is still allowed in the Ontario Smoke-Free Ontario Act, although some municipalities have already banned it. But this continues to this day, which is quite surprising because most countries in the Middle East now have banned indoor use. So we're finding use is still increasing, especially among young people. And as Dr. Hawari mentioned, it seems to be driven by the new flavored hookah, which was only introduced about 25 years ago. there's a good study done in Syria that showed the expansion of use. So this was an entirely new epidemic of use and doesn't seem to be related that much to traditional or use of hookah, which is other forms. It was all tobacco. They didn't used to use herbal, as far as I know. So there's been a huge increase in availability in the types of venues serving it. There's some people have referred to it as a Wild West out there because there's virtually no regulation of the product, of packaging, of warnings, of sanitary conditions, and so forth. So it's, and as I mentioned, herbal is exempted from the Smoke-Free Ontario Act, and the difficulty has been determining whether places that said they were serving herbal are really just serving herbal. And in fact, herbal is just as hazardous as tobacco water pipe, but it is not covered at this point under the Smoke-Free Ontario Act, which is just includes tobacco. So we wanted to find out too if any of these places who legally were only allowed to serve herbal water pipe were actually serving tobacco water pipe or herbal with added nicotine juice. There's tremendous misinformation about safety. People think it's safe, that the water filters all the bad stuff, which, as you've seen, is not true. And there are a lot of new information on exposure in various surveys. So these are some photos of actual water pipe cafes in Toronto. I think we now have probably 100. It's grown over the years. In 2012, we surveyed 17 cafes. We were given names of about 30 provided by Toronto Public Health. They eliminated some of the ones that they thought might be dangerous. And uniquely in this study, we also measured exposure on outdoor patios. We limited it to those that served water pipe during the evening, which is pretty well all of them. It tends to be served quite late in the evening and often goes on till the wee hours. And it had to be feasible to collect air quality data. So in 2012, we had a phase of site selection and taking different measures. And then our staff went out in pairs to hookah cafes fairly late in the evening, which was also a unique part of our study. We used the TSI side pack, which is used in many studies to measure tobacco smoke. And this measures the ultrafine particles, the ones that get deep into your lungs and cause serious trouble. The Q-track to measure carbon monoxide. We got active nicotine samplers to measure air nicotine. Normally for a passive sampler, you'd have to leave a little monitor in the cafe for a week, and that was not really feasible. We did not require ethical approval to do this because we were in a public place and we weren't interviewing or taking human measures. And we also measured breath CO and the blood CO in our non-smoking field staff to just see what happens when they were in this environment. We also measured a number of other measures in the environment so that we could interpret the data. So I'll show you some examples of readings we got in a couple of the places. The first venue I'm going to show you was a commercial area in an inner suburb with very poor ventilation, a mix of young people. Water pipe was served on the main floor and in the basement, and there was separate room from food service area where patrons smoked water pipe. So there are two graphs here. The top one is the particulate level, and the bottom one shows you the carbon monoxide. Now the particulates, you can see we took baseline measures outdoors first and then again at the end, and you see they go almost down to zero. You'll notice there's a red dotted line at the bottom, and that is the upper limit for very poor air quality, which is about 91, the level, it's micrograms per meters cubed. So all of these were way, way above very poor air quality. And you probably heard in the news that, for example, that a bad day in Beijing might be 300 or 400 or 500. Well, these levels were up in the thousands for a lot of the time that people were in there. So we're talking about levels that are, you would never reach outdoors unless you were, I don't know, in a fire. The CO levels, this particular one, much of the evening was pretty close to the 24-hour exposure limit for, this is for the province of Ontario. And there were also high levels of carbon dioxide as well, which is not as toxic, but it can dull your brain. And in the red line up there is the 15-minute exposure limit for industry. So in this case, the particulates were pretty terrible. And some of these places had the doors and windows open. The next venue was a local commercial area in an outer suburb with not only young but older patrons. There was some ventilation in the building, and it was a very busy venue with many tables and small areas. So the particulates you can see are somewhat lower, although they're still way, way above. And towards midnight, they were well over 2,000 as the number of hookahs increased. The carbon monoxide went above, towards the end of the evening, went above the 15-minute limit for industry. And those limits are established, it's just exposure to CO. When you combine it with exposure to all these particulates and to other toxins in the air, we don't really know, but it's a pretty serious problem. And it's not something that you really find anywhere else unless you have a very badly ventilated wood stove in your home or something. So it's difficult to compare cigarettes and Waterpipe, but we looked here at a study that was done in Kentucky because they only recently banned indoor use of cigarettes. And before the ban, their particulate levels, PM 2.5, range from 67 to 304. And if you look at the indoor average for Toronto Waterpipe cafes, it was more than double the maximum that was found in smoky bars before the bans. After the ban, it was greatly reduced, 9 to 32. Now, I should mention that the relatively safe limit is about 25. So even outdoors, we found particulate levels of 35, which are higher than ideal. And of course, if you're within 1 or 2 meters of a smoker, we found this with data from cigarette smoking, you can get quite high exposures outdoors as well. In looking at carbon monoxide, we found data from São Paulo where they did measure before a ban, and they had an average of 4.6 parts per million. In our study, the average was 12.5. So this was almost 3 times the risk compared to cigarettes. And this is largely because of the charcoal, which accounts for anywhere from 75 to 90% of the kind of exposures indoors. The tobacco itself or the herbal preparation also, it's, people say it isn't burned, but it actually, there is pyrolysis. So, and when things are warmed up to the point where they are starting to burn at low temperatures, it's actually more toxic. You get a much cleaner burn at higher temperatures. So the question our Ministry of Health was interested in knowing was, are they actually using tobacco? Because nobody had ever done a systematic measurement in many cafes. There was only sort of specific cases where they would take a product and send it to Ottawa for testing, and it was quite expensive. So we found in other cities, we looked at studies where they had measured air nicotine in other cities. So when there was a ban, the nicotine levels were below 0.1 on average, whereas without bans, they were close to 3 and somewhat as high as 4.56. So the average air nicotine in smoky bars is roughly 3 micrograms per meters cubed. So what did we find in Toronto? Well, we didn't find any under 0.1. We only found one that was less than 0.5, which suggests there was some nicotine being served. And it went up from there, and half of the venues, the indoor venues, were above the average for found in other smoky bars. So they were clearly serving a lot of nicotine product, even though it was not legal. So that's the end of my talk for now. Dr. Hawari and I will be happy to entertain your questions.
Dr. Hawari, please feel free to unmute your microphone and share your webcam again for the question and answer period. And if anyone has any questions, please type them into the chat box. I'm just going to scroll up a little bit to see if there are any questions posted previously. Oh, here's a question. Gary, what about third-hand smoke particulates?
That's something we didn't measure in this study because we would have had to do nicotine wipes, and it would be too obvious what we were doing. But I'm quite sure in other studies where smoking occurs, there is a lot of third-hand smoke, and people would be leaving there with stuff on their clothes, their hair. There's been a lot of research done on third-hand smoke now, and it's very invasive. Areas get completely contaminated. And with that level of particulates, especially in places that have drapes and carpets, and Waterpipe cafes are often done up in a way that there is a lot of fabric and sort of soft, a soft environment. So you would get probably very high levels of third-hand smoke. And as we know now, they continue to off-gas for days, weeks, and months, and it's almost impossible. It goes into the walls, into the drywall. It even, I found out recently, will go into metal, which is pretty scary.
Okay, next question from Melissa. How would you describe the relationship between mental health and Waterpipe smoking?
That's a good question.
Dr. Hawari, would you be able to speak to that at all? Dr. Hawari, are you still there? Could you unmute? Oh, there we go. Dr. Hawari, are you still there?
Yes.
There we go.
I can hear it, yes. Is there a specific question that you
So
want me
there's
to
one
answer?
question here. How would you describe the relationship between mental health and water pipe smoking?
I can. I'm not aware of the relation in that. I don't know if I can't answer that, but I can answer the question about the tobacco industry in Waterpipe. We are seeing tobacco companies here actually investing in Waterpipe, and some of them they're selling their tobacco component, their cigarette component, to other tobacco industries, and shifting to Waterpipe. But I'm not sure I understand the question about the mental health and tobacco and Waterpipe. I don't think I understand what they meant by the relation.
So Melissa's asked, has added social addiction as a possible mental health issue. I'm not quite sure what you mean, but
Yeah.
if you're spending an awful lot of time with a dull brain and CO hangovers, it's probably not very good for your mental health. And I mean, addiction is a mental health issue. So it's not a very good answer, but I'm sure most substance use is associated to some extent. I mean, people with mental health issues have higher risk, and some addictive substances cause mental health problems. For the
The social addiction.
The Smoke-Free Ontario Act, I think they're looking at the hookah issue. They haven't announced anything definite at this point. And the e-cigarette question, there isn't any strong evidence yet that e-cigarettes have a net harm reduction. They may reduce harm for certain individuals, but there's no evidence on a population basis because you're still using nicotine. There's various metals in e-cigarettes. The data are all coming out fast and furious now, and none of it is particularly reassuring. So I think the evidence is much better for traditional therapeutic nicotine and other therapeutic products.
There's a question here from Loretta. Will the Smoke-Free Ontario Act be changed in the near future? You did? Okay, sorry. That was already addressed. Which ingredients must be listed on the packaging of tobacco for water pipes?
Nothing. I don't know anywhere that has firm regulations on that. Some of the packaging says it's good for you. So it's pretty well unregulated as far as I know, unless Dr. Hawari is aware of new regulations.
No, that's exactly right. In fact, some of them actually write that it has zero tar, saying because it's not yet burned. So that's really very misleading. Of course, it's going to have zero tar until you burn it. There was another question about other campaigns on how to inform people about the water pipe harms. And yes, we are doing that in the Middle East as part of our curriculum for our healthcare providers to treat tobacco dependence. And we do have a special session on water pipe. So we discuss all the harms and the myths of water pipe. And there is now a big campaign in Jordan to try and ban water pipe. Of course, surprisingly, it was faced with live demonstrations by some of the people, which we think has been actually supported by the tobacco industry, to go out, demonstrate in front of the parliament, demanding their right to smoke. So it's a tough battle, but things are moving. We're hoping that we can achieve something, but it's going to be a very difficult battle.
Now, Amin has two questions. The mental health issue again. People enjoy the social aspects of it. They get together with friends and so forth. So I don't know if that's so much. Maybe it improves mood. I don't know. But it does raise another issue that we haven't talked about much, and that is the danger of transmission of infectious diseases. And there, even with disposable mouthpieces, which a lot of places have now, there's still the hose, which can be contaminated with saliva, and there's information showing that it can transmit tuberculosis, meningitis, hepatitis, and less serious diseases. So that is still a problem that needs to be looked at. And as far as it being manufactured out of Canada, thousands of things are manufactured outside of Canada and are regulated more than Waterpipe tobacco or Waterpipe products.
If I can comment also on the hoses. Now, actually, in this part of the world, there are disposable hoses. So you can buy the hose for about $1.50. And of course, it's made of the worst kind of plastic you can think of. But really, they are ahead of us. So if you buy your hose, you smoke, you throw it away. It's a little bit more expensive, but if you're willing to spend $5 on a water pipe, you're going to pay that extra $1.50.
Well, that's good to know. I didn't know that.
There's a question here. Are you aware of any public health strategies to inform the people of the harms of water pipes in Canada or the Middle East? Okay,
Yeah,
sorry.
I think I just answered that actually.
Okay, there's a question here from Lee. In my opinion, we are looking at a generation of e-cigarette smokers here in Ontario. Young people are using these e-cigarettes in schools, and although it is not a water pipe, I wanted to know your thoughts on a political movement to regulate both e-cigarettes and water pipes.
I'm all for it. The problem with e-cigarettes is even if they turn out to be less hazardous, they're still hazardous. We know that much now. And the problem is that a lot of them look like cigarettes. So it's greatly increased the visibility of cigarettes. And people have been advertising with them. So they're basically advertising cigarettes. So this is a huge problem because reducing the visibility is a critical component, what we call social exposure. And it's just as important as reducing, other forms of availability.
And if I may comment also on this issue, that with the e-cigarettes, we're noticing that patients are becoming more dependent on nicotine because of the false sensation of security with the e-cigarettes, to the point that actually we're beginning to see them come to our clinic asking if we can treat them for addiction of their e-cigarette. So we have a couple of patients that came to our clinic, and we've used our approach that we use with the regular cigarettes to get them off e-cigarettes. So that's really an interesting thing that we're beginning to see now.
Because even e-cigarettes, e-cigarettes without nicotine, it's not clear that that's a go as a product. Most people add nicotine to them in various amounts because it's not likely. There's some evidence with regular cigarettes that the smoke and other components of the cigarette may contribute to the addiction. So it's not clear nicotine-free e-cigarettes. It would be just the flavorings, but even the flavorings are hazardous. Scented candles are more hazardous than regular candles. So it's the same. Flavors have things in them that you probably shouldn't be inhaling into your lungs.
Okay, there's another question here from Liz. Are there any studies done to show the effects of water pipes on transmitting respiratory infectious diseases?
Well, I think I addressed that before. There's certainly evidence that when you don't use, when you share the hose or the mouthpiece, you can transmit all kinds of infectious diseases, respiratory and otherwise. So it can be quite hazardous.
And there's a question here from Melissa. How can shisha be regulated through online purchases into Canada? And sorry, it's a two-part question. And who would we need to approach?
At this point, I don't know how well it's regulated. There have been attempts to regulate online sales of other products. Sometimes they make deals with couriers not to deliver to people who are under 18, but it's very difficult. But there are ways of I don't know who one would approach, but it's Health Canada really hasn't done too much at this point with regard, although right now it is still not legal to have nicotine water pipe products sold in Canada or advertised.
Okay, so we're just about out of time now. I want to thank both Dr. Hawari and Dr. Ferrence for a very informative webinar session today. We hope that you all enjoyed it. And just a friendly reminder that the link to the Pulse Learning Assessment and course evaluation will be sent out by email. They will be sent tomorrow morning, and you will have 1 week to complete the assessment in order to receive your letter of completion. If you participated as a group today, please be sure to email me a complete list of participants by end of day today. And our next Lunch and Learn webinar session is on March 25th on tobacco control interventions for young adults. Great, thank you everyone. Thank you, Dr. Hawari, and thank you, Dr. Ferrence.
Great, thank you everyone. It's a pleasure.
Thank you very much.